on the state.
Government, through the Ministry of Gender, Labour and Social Development, recently developed National Social Protection Strategy with the aim of extending social protection reach.
These provide a framework for supporting the delivery of social protection, including integrating it into National Development Plan 3 and now 4.
Whereas this is seen as a step in the right direction, the chairperson, Uganda Parliamentary Forum on Social Protection, Flavia Kabahenda, says this will only generate returns if a legal framework is put in place.
I want to thank the Ministry of Gender for moving from policy, and now they have a national social protection strategy. So let's go on. We now need a law for us as the Uganda Parliamentary Forum on Social Protection. That is so little done and so much to do. We now need a law that will actually sanction and also deal with those who will not comply in as far as social protection is concerned.
Government has, for the past 15 years, been running a social assistance grant for empowerment program through which elderly persons of ages 80 and above receive a monthly stipend of 25,000 shillings. While there could be evidence that the SAGE program has positively impacted the lives of the beneficiaries, there are allegations that a big portion of this money is spent on health and education needs, thus leaving an untraceable footprint.
When they touch this money, we know that 26% of older persons look after children. Who are these? They're either grandchildren, they're either orphans and vulnerable children, or the children under their care.
But then make sure the little money they have earned is not spent on things government can cover. So can we have free health care? Because when you look at out of pocket, in our budgeting and strategic planning is 40% of the health budget.
Even with the 25, we have seen the importance of the grant. We have seen how it is affecting poverty. We have seen how it is increasing school attendance. We have seen how it is increasing meals consumption. But for us to be able to maximize this benefit, it would also be very good that the value of the grant is also kept at pace with the rate of inflation we have in the country.
This was highlighted during a roundtable dialogue on the state of social protection in Uganda, organized by the International Center for Research on Women, ICRW.
And the conversations that we have had in this room are very critical because these are now going to form or to shape the next conversations around advocacy for better social protection interventions. We also want to find out which are the social protection interventions that work, that are effective, especially for women and children.
According to reports, social protection spending in Uganda has for years not exceeded 1% of GDP. Dorcas Kimono, UBC News.